Hey, it's me again, Joe 508. All right, so we're going to do the second lecture for week 2, and we're going to continue to connect the dots. And so we've built this case for stress and the kind of the physiological change that happens to bring on board your body to interact with your brain to fight off a potentially life-threatening, challenging situation. However, we tap into it chronically um, through chronic stress. We're going to talk about anxiety today, anxiety disorders, and then we're going to start making the link to the diabetic situation and condition because of the chronic elevation of cortisol. Um, we can create a hormonal condition that will result in insulin resistance. Cortisol will directly influence the sensitivity of insulin receptors over time, and so which is a bad thing. And we will then see how this then we go from stress damaging the brain unto itself when it's chronic, but also by creating the diabetic condition, um, will create what's referred to in some vernaculars as type 2 diabetes or Alzheimer's disease, because sadly, when we look at the body to mind connection, 80%, 80 of Alzheimer's patients have diabetes. Okay. All right. I realized I forgot to tell the entire story of the quilts right there, and Julie's grandmother, she made all those quilts. Yeah, so some of these quilts are really quite old. These are a little over 100 years old. This one right here is a little over 150 years old. So these are all about 100 years old. So it's pretty cool. Pretty cool family culture, and we get to relive this culture. Because I used to go back with her for years and years and years, every holiday to go visit her grandparents. It was really a trip for me being a Southern California boy, and by being lucky enough to have this really sustaining and fulfilling marriage, we get to reminisce together, okay, and be nostalgic about these kinds of things, which is way cool. And if you were to come to our house someday, and hopefully maybe someday after COVID-19, you can all come visit me, and you'll see that um, you know, for a happy couple, lucky couple, we are full of nostalgic experiences that are put all over our walls. So, okay. Alrighty, let's check this out here. Let's go on to the next assignment for this week 2. Okay, and as promised, I'm going to be going into a discussion on how stress can damage the brain, lead to depression and dementia. And you're going to beginning to see that they kind of interact. One causes the other, and the other causes the other. So, um, so yes, stress causes an overactive adrenal release of cortisol, and cortisol can lead to diabetes, um, but cortisol can also cause increased clinical depression. Okay, and then increased clinical depression causes more hyperactive HPA axis, more cortisol. It just becomes a very circular thing, and over a lifespan over 30, 40 years, then that cortisol begins to cause damage to the brain. Okay, it leads to diabetes and damage, to Alzheimer's disease, sorry, and damage to the body through diabetes, and they do intersect. Okay, the inflammation that happens in the brain from diabetes and the inability to get fuel to the brain that happens with diabetes is one of those risk factors for Alzheimer's disease. Okay, so these are the key points that are raised in this article right here, and we just brought out the figure and put it up there. Okay, so we're going to talk a little bit about anxiety. Okay, and anxiety and stress are very, very linked. Okay, stress being the inability to experience pleasure. You go back and look at the um, video that Robert Sapolsky talked about. Oftentimes psychomotor dysfunction, physiological dysfunction, and then anxiety is something that is a bit of rumination where you're in anticipation of triggers that will be threatening, okay, and or you'll see a trigger that is threatening and you become anxious, okay, and a lot of us have I have really profound ADHD and I have OCD. And so when I walk around the house and, two boys, one 24 and the other 19, and sometimes they don't clean up and there's disorder, it causes my heart to race. It's not logical, but it is the way I am put together genetically. Okay, so I have a bit of anxiety disorder. And if I do not fix the disorder, then I get really, really stressed out. All right. So Julie told me a long time ago, okay, if you don't like it, then you need to change it. And so that's what I do. So I'm the order keeper in the house. We all have our jobs. She is phenomenal in terms of managing the kids and amazing in terms of tech and computer. And she does all of our financial planning because she's so good at computers. She also runs our Fidelity website. Um, and beyond that, she's an incredible attorney and on and on and on. I can't say enough, but I'm the order keeper. Okay, awesome. So let's take a look at anxiety. And what, actually, before I get there, let's go over these key points, right? So pathological anxiety and chronic stress, okay? So you can have chronic stress that's not, I mean, chronic stress can be the real deal, right? Um, you do not have money coming in, okay? That is a very stressful situation. This is not made up, okay? Um, you have you live, as we saw from the very first Sapolsky video, in a neighborhood that's extremely dangerous. You have to be vigilant all the time. This is truly perceived stress. And it's because of the sensory information that's coming up. Okay, anxiety is almost like it's anticipation of something. If I have to do public speaking days in advance of doing the talk, I start to have anxiety about that, and then that causes like stress hormones. Okay, both of these left unchecked, unmanaged, put you at risk for clinical depression. Okay, and it's due in large part to the effects of cortisol and what it does to the levels of your monoamine hormones in your brain that affect your affect. Okay, affect your affect. How's that sound? Okay. Um, and so some of the neuropsychiatric disorders that these conditions of stress and anxiety are associated with are depression and dementia. All right. So we've already talked about this. My amygdala grows if I'm chronically stressed. It's my fear, my anger, my fight or flight activating center. It gets bigger. Okay. It has plasticity. The neurons get larger and larger. Okay. And because of that, I have a hair trigger in terms of my fear or my anxiety. And so I have a deficit in regulating my emotions. Okay. Um, and at the same time, okay, chronic stress hormones will begin to cause atrophy, as we saw from the Sapolsky video, in my hippocampus and atrophy in my prefrontal cortex, two crucial brain areas that I use for my working memory, for my decision making, and most importantly, to corral in my fears and my anxieties. Okay, that's what cognitive behavioral therapy does. It causes those structures to coordinate and work together, the hippocampus and prefrontal cortex, for them to grow. And the bigger they are, the more they can impose their will on the amygdala. It's crazy how circuit based it is. Okay, and it's incredibly complicated, but in some ways, it's somewhat simple. But it's the hardest thing to do is to train yourself and to stay in cognitive behavioral therapy training. Okay. Um, so these stress-induced changes of a shrinking of the hippocampus, of a shrinking of prefrontal cortex, okay, they contribute to clinical depression. Okay, my prefrontal cortex needs to be big and active and well-tuned, so I don't get into depression. In fact, one of the treatments for clinical depression outside of pharmacological therapy is transcranial magnetic stimulation. They put two magnets here, and what it does is it increases the activity and the neurons begin to grow. Okay. Alrighty, but if they shrink, then I'm going to have impairment in terms of my affect and behavior, and also if they shrink, I'm going to have significant impairments in my ability to store new memories, my working memory, all signs of Alzheimer's disease. Okay, there's evidence, all right, that proper care and treatment of the underlying reason for the anxiety or the depression um, will pharmacological treatment as along as cognitive behavioral therapy will cause a restoration of some of the brain areas. Okay, we can do this through just size imaging, which is magnetic resonance imaging, and we can also figure this out through looking at activity levels using what's called functional magnetic resonance imaging. And this is kind of stuff work that Mara Mather in our group does. That Anjay Irimier. These are all experts in functional MRI. All right, so we can take a look at this article. Again, this is, again, I just expect you to just breeze through these articles and do not get caught up in the details, okay? So they go through the very things that I was talking about right now, all right? So I gave you a really good overview about the structural degenerative changes that happen with anxiety and stress, okay? Again, it's the triad that they're talking about in this article of um, the amygdala, which is anger, fear, rage. Okay, the bigger it gets, and it does get bigger, the worse off you are in terms of being hair trigger and deeper into the pathology of anxiety and stress. And then the ability of the other guys of the triad of the triangle, the hippocampus and the prefrontal cortex, to work together to try and minimize how active that is by thinking through things. Okay. Um, Okay, all right. So that's what this is all about. So then they go through again defining anxiety. Okay, and it's again unease, nervousness, worry, uncertain outcome. Okay, that my example of public speaking, you can have lots and lots of anxiety. Sometimes you can be anxious about what am I going to do with my life. Okay, I'm trying to get my degree and I want to have a profession, and these are all different types of anxiety. Okay. Um, as they indicate here, we can say anxiety, fear, stress. They often kind of use interchangeably, and it all depends on the context of what it is. Okay, um, they all elicit the emotional response. Okay, that we've been talking about. Okay, and we can see that anxiety is associated with a hypothetical of something that really maybe hasn't even happened. Okay. Um, there's lots of anxieties. Claustrophobia is an anxiety disorder. That being in this closed environment will cause imminent harm and damage. It's not based in reality, but it is an anxiety disorder. And so, for Julia, she has claustrophobia. When she looks at a CT machine or an MRI, she has arrhythmias. And it's horrible. So she has to take what are called anxiolytics. She takes a good old dose of Xanax before she has to have any imaging done. Okay. All righty. So again, this is lots and lots of review of what we've already talked about in the preceding parts of the course. So this is the figure that I placed in the blackboard. This shows you the actual anatomy and the interaction, and you can just kind of course through this. There's different types of prefrontal cortex, and it's beyond the nature of this course, but it does show you how the medial versus lateral prefrontal cortex can have excitatory, inhibitory. It just all depends on the context of the incoming triggers or events. Okay. Um, we have everything color coded here. Okay, so there's red and there's green. So there's an emotional memory, fear conditioning memory, and this really, we've all had those really really emotional memories that it's like a moment frozen in time. It's so solidified by the interaction of the circuitry. Okay, and then we see here again yellow refers to the emotional regulation and learning and memory, and then we see here the red is contextual regulation. And so, yeah, it's just a way of kind of function looking at the anatomy, right? All right, so then we go over here, okay, and they go into a lot more detail. They talk about the sensory components. I always talk about how the sensory information has to come in, and that's what this is. And this is way beyond this course, okay? And they really break down the frontal cortex into we have the ventrolateral prefrontal cortex, the orbital frontal prefrontal cortex, da, 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 this is beyond the scope of this course. But just read through it in awareness of what's going on. Okay, they do reflect. They refer to different types of brain anatomy. Super simple. Dorsal means top, and ventral means bottom. Um, so your frontal cortex is over here. Okay, over here is the hippocampus, and deep down is the amygdala. So they refer to this, and they talk about top-down or dorsal neural systems regulating our emotional responses of our amygdala. Okay, and so again, they look at the triad, hippocampus and cortex, hippocampus and cortex. They go through all of this. So you're going to see that a lot of this is review with a little extra added detail that is put into it. So they talk about the functional neuroanatomy of anxiety disorders, and again, it's the same as stress, okay? And they talk about the neurocircuitry of the stress response. So we perceive the incoming information. We have you can take what they say about the anxiety disorders, okay, and then how it's contextualized into things like fear and anticipation, and then that's going to activate the hypothalamic pituitary adrenal axis, and then bring the body on board. Okay, alrighty. And then they talk about the pathology of being anxious all the time and having chronic stress. Okay, and so in this particular article, they start talking about the risk for things like Alzheimer's disease. Okay, and how there's lots of this would be epidemiology where thousands of people are studied, and we can find out if they were anxious in youth. So I know it's behavioral, it's somewhat it's subjective and that is based on an interview, but nonetheless you get enough statistical power and analysis and you start making some types of predictions. Okay. All right. So we look in people that have had chronic anxiety, have had chronic depression, or have had chronic stress, and we can see through MRI analysis, okay, that they're damaged. They have damage to the hippocampus, and they have damage to the prefrontal cortex. It's actually smaller, okay, and this is quantitative, not qualitative. So, okay, and yeah, so it's the real deal. And then they go in here and they talk about different types of drugs. So we can take drugs that again modulate the way our adrenaline rush works. They talk about this with the PTSD and prazosin. We can take antidepressants, and all this has been shown to cause a return in the anatomy. So it can come back. Okay, it just depends on how long. Sometimes there is actually cell loss, and that could be a little bit harder. But if this is just dendritic changes, then we're in a good situation. Okay, all righty. So that links to this. Again, this is it's a really neat video. It's from HBO, and it talks. It's a 20-minute
malevolent condition,
and it talks about the linkages that you will make between anxiety, depression, um, insulin resistance, developing of diabetes, and then Alzheimer's disease. And this taps into this article right here. Okay. Um, and this particular article, and this is a fairly molecular article, so I just want you to sift through it and again read through it superficially. Okay, but do understand? You look at this and they talk about the Alzheimer's disease. They talk about a key component here is that we get insulin resistance. Okay, that happens with diabetes, right? So we're making this the case. We're building a house towards stress and stress-related diabetes. Okay, and certainly it's a combination of diet, it's a combination of genetics. Okay, so if you have a history of diabetes in your family, you're at super high risk. It's nurture versus nature, and then it's a combination of, and then we add on stress that the cortisol causes insulin resistance. Oftentimes, you'll see with elevated levels of stress hormones, you'll have deposition of fats in abnormal places, especially visceral fat or tummy fat, and then that releases factors that contribute to insulin resistance as well. Okay, there's so many things that happen with insulin resistance, but one key thing is brain inflammation, and you can decode all the proteins. The immune system looks at it the same way it would a virus, and and attacks it like it does, or attacks bacteria, and you cut this inflammatory condition in the brain, and things get into the brain that are not supposed to. We have a blood-brain barrier, and that gets compromised. That's part one. Part two, um, when our brains need energy, and they need energy all the time. So our brains are maybe 2% of our body weight. They consume between 20 and 30% of all the calories that we bring in. Okay, so they cannot store fat. They need glucose. Right? So there's no glycogen storage. There's no fat storage. So you need to have elevated blood glucose, and if part one, and then the glucose needs to be able to be transported into the nerve cells, and this is where we have insulin. Another key element is called IGF-1. Paul Longo has made this famous. Okay, um, when it's compromised and you're not getting glucose into the brain cells, they begin to die off. And that's what happens with Alzheimer's. It's a funny little teeter-totter. I'm going to send you guys a paper later on. There's an inverse relationship. So when we have high levels of, um, of IGF-1, okay, and high levels of insulin that is characteristic of insulin resistance, this can stimulate growth, okay, and produce cancer, okay. When you have insulin resistance in the brain, um, uh, it can be a totally different story, and you can get atrophy. So we tend to see that people that have cancer tend not to get Alzheimer's. Uh, Inversely, people with Alzheimer's disease tend to have lower levels of cancer. So it's kind of an interesting relationship. All right, so there's a lot of terminology in here, okay? But I just want you to look through it. They talk about Alzheimer's disease. They talk about some of the key pathologies in the cells. They talk about here. So this is um, beta amyloid or amyloid beta. You hear it both ways, okay? And we see phosphorylated tau. And both of these accumulate and are associated with degeneration, okay? And that's what this is all about, okay? They talk about glucose, like I said, being super primary, okay, for neurons, okay? And if you don't have adequate signals to let the glucose into the cells, which would be insulin receptor function, IGF-1 receptor function, then you're going to have all these pathologies that we see right here, okay? And it goes through the accumulation of beta amyloid and phosphorylated tau, but then we also have things like oxidative stress. Reactive oxygen species. That's why we take our antioxidants, and things like mitochondrial dysfunction. All right. All right. So then they review what it is that these two hormones do in the brain. Again, they're crucial because your brain is completely dependent on glucose. It cannot burn fat. Okay. And then they build the case that brain insulin and IGF-1 resistance happens in Alzheimer's disease. And there's lots and lots and lots of evidence supporting this. Alzheimer's is complicated. We also have, like I said, the inflammatory disease. Okay. Alrighty. When you are not having an efficient engine, this is when you start to have oxidative stress. And they talk about this in this part. Just go through it as quickly as you can. I may try and find one that's a little simpler. This was, at the time, was a pretty good article, for me to read. But this, it is a bit complicated. So just sift through it. Okay. When you have impaired IGF-1, we see associated with that increased evidence of tau pathology, which is choking off of the neurons, the protein that gets dysregulated, and then also increased evidence of plaques that build up from amyloid beta. Okay. Alrighty. And then they go over the potential reasons for the insulin resistance. All right, so that is that. I'm going to get out of your way right here. Okay. Please watch this video. It's an unbelievably good video. There's your quiz. And then we're going to get in here and we're going to make this relationship. And we're going to ask you to tell us again what happens in the brain after chronic stress that might eventually generate a full-blown stress response. How does the circuitry change? The triad that we were talking about. Okay. All right. and then start to make the links to diabetes and why that was a risk for Alzheimer's disease. All right. Okay, guys. So that is lecture number 2. I want you guys to have a great week, and feel free to contact Julia at any point in time. And before you know it, we're going to start getting into some of the studies that show you that interventions do work. Interventions help pull back the layers of the onion of anxiety and stress and get you to a good place. All right. Until then, we're going to say goodbye. You guys get a little another picture of Julia and I, and you guys take care.